Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain-Free with Dr. Marc Darrow from the Darrow Stem Cell Institute in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor, board certified in physical medicine and rehabilitation. He teaches about the use of prolotherapy, PRP, and stem cells. Today's program could open up a new life without pain for you. Now, here's Dr. Darrow with his co-host, Nita Valens.
Well, hi there, Dr. Darrow.
Hello, Nita Valens. How are you doing today?
I'm great. How are you?
I'm living it up. I hope you are, and I hope all of our patients are who are listening. And I hope the new audience who's switching channels around, listening to us, are living it up too. Because we're going to help them today learn about how to heal their musculoskeletal orthopedic pain, everything from the back of the head to the bottom of the feet, and necks, backs, arthritis, shoulders, knees, ankles, toes, fingers, elbows, you name it, we do it. And I've been doing this work for over 25 years. Started at my residency at UCLA way back. And it's amazing, amazing work. It's called regenerative medicine. That means instead of using a knife to cut tissue out, what we do is to stimulate new tissue to grow back by simple injections. And you have something to say about that, I'm sure, Anita. What is it?
Well, it worked on me.
And it worked on me many, many, many times.
I know you're kind of a chronic abuser of your body. You're a sports guy.
Yeah, I'm an addict. I'm a sports addict. And I use the needle to heal.
Well, maybe you better explain that last sentence just so people who might be brand new.
Yeah. What I do is I inject platelets and stem cells into my own body when I'm injured. Right now I'm doing really good, and I can do all the sports that I want to. I'm playing golf, running, lifting weights. Those are my main three right now. And I'm going to go to Hawaii in a few weeks, so maybe I'll be out on the surf, maybe windsurfing. What else do I do there? I go hiking up. I like to go to Diamond Head and hike up there. So anyone who wants to meet me, we can hang out.
Well, that sounds pretty exciting.
Actually, I met a guy. I was playing golf. Where was I? I was up at Pebble Beach, and I met a man, and I said, I'm going to Hawaii. He goes, I'll meet you there.
Oh, how funny.
Yeah,
did he?
Well, it hasn't happened yet.
Oh, okay.
We're talking about it. I want to just use a simple example here after I give out the phone number, because we do want you to call us up and make the show really interesting with your issues or your friends' issues, things like meniscal tears, shoulder tears, labral tears, arthritis, plantar fasciitis, whatever your syndrome is. I do an awful lot of finger injections. I know that seems crazy, or wrists for arthritis, people that get sore. But the phone number to call me right now live, you can talk to me and ask questions. You ready? Get your pencil. 866-870-5752. That's 866-870-5752. So anything to say before I go to a question here?
Well, yeah, I want to tell everybody about the website, which is www.lastemcells.com. That's lastemcells.com. You can email Dr. Darrow off of every page on the site, and you can watch him doing actual videos of all these treatments. So if you're brand new to this concept, you might want to go check that out right now.
Great idea. And also on the website are videos of me injecting different parts of the body. You can see how I do this, how I get the platelets, how I get the stem cells. Very simple procedures. Nice thing is you walk in the office and you walk out. You don't need anyone to drive you. There's no anesthesia necessary. It's very simple. When you do as much as I do, we have it down. We have a huge staff. We're doing these all day, every day of the week. And I always tell people, if you want to get something done in medicine, go to the guy who does the most. I think that's me. Anyway, this question is really interesting. It says rejected ankle fusion. That's pretty complex. Let's see what they say.
Wow.
My dad is now 77, had an ankle fusion a year ago. It was rejected, and they had to remove the pins. He is in too much pain and does not want to take opioids or narcotics. Good man. The next option the doc has recommended is to use cadaver bone. That means bone from a dead guy. My dad has said he just cannot go through another 9 months of recovery. He has had 3 knee replacements. I didn't know people had 3 knees. Just kidding. They fail too, and sometimes they have to be replaced. And the other ankle has been fused, which he had when he was 70. He is a Vietnam vet who was a gunner and jumped out of helicopters along with a gas can man for NASCAR, whatever that means. He has used and abused his body and is looking for treatment for pain and recovery for the ankle. Any help would be greatly appreciated. We look forward to an alternative to surgery since we know there's no guarantees with surgery. Please give any advice and any consolation. Thank you. Well, that's really a sad case, but those are the kind of cases that I see all the time, failed surgeries. And people say, what does a failed surgery mean? Because there are diagnostic codes in surgery for failed surgery. If you have a back surgery and it comes out bad, that's called a failed surgery, failed back surgery. And there's a diagnosis for that, diagnostic code. So this is common for me to see this. I get people in probably every day who have a surgery that failed them. I'm not saying all surgeries fail. The group of people that come to see me have had that happen, though. Not everybody that comes to see me has had a failed surgery. Many people that come to see me are ready to get a surgery, though, and they ask my advice, which is generally always the same. Don't do it. Not a negative statement about orthopedic surgeons, by the way. I think they're the brightest guys in medicine. They do the hardest work. They're on their feet for hours and hours and hours. And one little mess up, and there's a big problem. Now, these failed surgeries don't mean the surgeon failed. They did a good job. It's just that surgery is not perfected at this time. It probably never will be. You know, you're trying to do a mechanical thing on a biological body. It doesn't always work out. And I am the one that it happened to, and that's why I do regenerative medicine with platelets and stem cells, because I had a shoulder surgery back in medical school, and I was all hyped up. I used to go in with the surgeons all the time. I was getting ready, training to be an orthopedic surgeon. And then after this surgery, I'm like, this didn't work out too well. I had a swollen arm full of fluid. I had a high fever, and I had 4 years of misery, much worse than the pain I had before the surgery. Until I learned about regenerative medicine, I injected my own shoulder one night. I know it's a great story. You think it can't be true. It is. I woke up the next morning completely pain-free. And that made me a believer and someone who started begging their patients, please let me try this on you. I haven't done that much of it back in the day. Now I think I've done more than anybody on the planet because it works. I'm going to give out the phone number. Give me a call. You can talk to me live right now, 866-870-5752. And by the way, if you do call in, I'm going to give you a free copy of my book. Pretty hefty book here, a couple 100 pages long. Stem Cell and Platelet Therapy, Regenerate, Don't Operate. And it's got all the studies that you'll ever want to read. I think there's 256 studies on why regenerative medicine works. I know if you go to most doctors, they go, oh, that can't work. It's because they don't know anything about it. It works. It's not going to work on everybody. Nothing works on everybody. But it works when I choose a patient who it's going to work on. Can I promise any results? No, I can't promise a thing. No doctor should be promising anything to a patient. But I can tell you the examples of people it works on, has worked on, and give you a good shot, that's a pun, at healing up without the knife. So also, if you want to call the office, there's people there. You can get more information. The number to the office is 800-300-9300. That's 800-300-9300. We would love to hear from you, and right now would be great. Anita, while I'm blabbing away, if you see any callers coming, I see one coming in now.
There's one coming in.
You can just interrupt me.
Yeah, I will. I'll just breathe.
I always know when I hear you breathing, you're chomping at the bit.
Yeah, but I'm on a break from breathing right now.
Yeah, I know, because you don't need to.
Yeah.
You're beyond that. You're in the higher realms.
That's right.
Okay, so we're going to go to Bonnie in Ontario. Her boyfriend in another state has knee issues. Bonnie, I'm sorry to hear that. Where does your
not a boyfriend, Doc.
Just a friend without a boy.
It's a friend, not a boy. It's a long-time friend of mine, another nurse.
Okay.
She has been getting PRP for a very long time, doctor.
Okay.
She recently had PRP, and she started getting a lot of swelling in this leg. And apparently, they had changed the tubes that they were using, and they think she may have had a reaction to whatever was the elements in the tube, and so. And this has been going on for 5 months, and she cannot get any. The leg will not stop swelling.
Okay, where does she live?
She lives in Western Pennsylvania. She lives in Murrysville, Pennsylvania.
Western Pennsylvania. Okay. Unfortunately, I can't drive over there today to take a look. I'm kidding. You're supposed to laugh. There's a lot of things. There's a lot of things. I know I can barely hear you too. So let's scream at each other and say it's okay. A lot of things could be going on. Number one, it could be the tubes. Who knows what that means? I've never heard of that before. It could be the doctor didn't use an ultrasound to inject with to guide the needle, and the solution.
He did that. She's been going to this guy for like 5 years.
Okay.
Because she doesn't do well with anesthesia.
Okay.
She has never wanted to get a knee replacement.
Okay, well, that's smart. It could have been that the solution went into the wrong place. It could have been a sterility problem. There's just 1,000 different possible reasons. I've never had that happen, and I've been doing this for over 25 years. Other than when I injected my own knee about, I think it was about a year ago, with hyaluronic acid. And they may have mixed that in with the PRP. That's very, very common to do. So hyaluronic acid is a lubricant. There are different names of it like Hyalgan and Synvisc and things like that. And sometimes the doctor will just put a drop of that in with the platelet-rich plasma, the PRP. And I don't do that. I never have done it. I did it to myself as an experience. And guess what happened to my leg, Bonnie? Bonnie is still with us? Okay.
The only thing that concerns me is that, now she's wondering whether she should try to, he's going to put her on some steroids, and she's going to try that for a little while to see if it was an allergic reaction. They're not positive, but that's the only thing they can figure out, because the only thing that has changed between when she had it done before and when she had it done this time that she's had the problem is the tubes and the centrifuge.
Okay. Well, that may not be the only thing. That's the only thing that you know about. And there's a lot of things that go on that we don't know about. And I'm going to tell you what worked for me. I don't know if you were listening to me or not when I was talking.
And they did blood work, and there was no increase in the white blood cells or anything of that nature.
Okay, that's cool. We don't know what happened, Bonnie, but I do know that what happened to me. I put some hyaluronic acid in my knee, and my leg blew up like a balloon, all right? And that lasted for about 5 months. And the thing that helped me quite a bit was I did lavage of my knee. Lavage means I put some saline in and aspirated it out, okay? And I did that a few times. And then I did something called EECP. You'll have to look that up. It's something like external extracorporeal pulsation. And they have those all over. It's done mainly to open up the collateral vessels in the heart, the coronary arteries. So what it does, when the heart is at rest, it pumps the legs. So I do that every few years just to protect my heart and keep me heart healthy. And I went in there, because I was doing it at that time. And guess what happened to my leg? It healed up. I was on crutches for a few months. So my heart goes out to your friend, Bonnie. I think if you want...
I mean, this woman is 74 years old, and she was pressing with her legs before this all happened.
Yeah, guess what? I was doing that stuff too. I know. I would have her email me, and I'll give her the information. And the email address you can get through my website. Every page on my website has a place to email me. And that website is www.lastemcells.com. I'll be glad to help her out with whatever information I have. And if she emails me through the website, I will call her immediately. Okay?
All right. All right. Thank you so much, Doctor. I really appreciate your assistance.
Thank you, Bonnie. Appreciate your call.
Wow, that's a terrible story, huh?
Yeah, absolutely.
But I know what it's like. And I don't doubt that the same thing happened to this woman that happened to me, because that's a similar scenario. But who knows? There's, people go, this is what happened to me. And I go, how do you know that happened to you? Things in medicine are complex. There's so many moving parts. And they go, well, this is what happened. And I go, you don't know that. You know part of what you know, but you don't know all of it. And I don't know all of it, and no one knows all of it. And there's a lot of bad things that happen in medicine. As we all know, the number 3 cause of death in our country is, what's the word, Nita? Let's see if you remember.
Iatrogenic.
I love Nita. She's a brilliant person and a good memory. Yes, iatrogenic means it's caused by the doctor, the medicine, the hospital, something medically related that shouldn't have happened otherwise. So this may have been one of those iatrogenic things. And guess what? Sometimes things happen to people that wasn't caused by the doctor at all. And then something happened with the doctor, some intervention, and they blame the doctor when it had nothing to do.
Well, sometimes things just happen.
Sometimes things just happen. This person could have had a DVT, a deep vein thrombosis. That happens to people all the time without any medical intervention. I'm not saying it's the doctor's fault or not the doctor's fault. I don't know. And I'm sure they're investigating it now. I'm sure that doctor is doing a great job of trying to figure out what happened so it never happens again. Sometimes, though, it can be where the solution is placed into the soft tissue rather than into the joint capsule. That's why I asked if that doctor used an ultrasound to guide the needle. And even with the needle guidance, you can still theoretically miss. Depends on the experience of the doctor, and it depends on just too many things. There's a
lot of variables.
There's a lot of variables.
Bodies are very complicated,
and medicine's very complicated. So I'm gonna give out the phone number to call me live right now. Thank you so much, Bonnie, for calling in. I appreciate that call. And if you want to reach me and talk to me live right now, it's 866-870-5752. That's 866-870-5752. And if we miss something that you're calling about, or you didn't call, if you were shy, don't be shy, though. Use a fake name. Say it's your father, whatever. You can call the office at 800-300-9300. That's 800-300-9300. I want to just mention while the callers are coming in here that we also do the procedure of regenerative medicine using platelets, PRP, platelet-rich plasma on the face. That's called the vampire facelift. And we can also use stem cells on the face and on the head for hair regeneration to revitalize the follicles in the hair. And both are very simple procedures to do. We're going to go to Alex about his foot. Alex, Dr. Marc Darrow, how are you today?
Hi, I'm doing good. How are you?
We're living it up, man. We're happy we're here.
I could hear it. You have some very good rebuttals for some of your callers. So I am not certain if my particular ailment is in your jurisdiction.
Okay.
What I have is drop foot.
Okay.
Or foot drop.
Sure.
Like it's the one and the same. I just had a very weird situation where my foot was restrained for way too long of a period of time.
Okay.
And it was essentially, completely asleep for about, I want to say, a couple of weeks.
Okay.
Until I started doing some serious physical therapy on it. And right now I'm about, I want to say it's like about 65 to 70% feeling that I have back in it.
Good.
But the main thing that's been bothering me about it is the pain lately.
Okay.
For about the past week or so now, unless I'm moving around, doing any kind of exercising with it, walking, if I'm just trying to get some sleep, it's like just killer pain.
Okay. May I ask you a few questions?
Absolutely.
Why was your foot restrained for a couple of weeks?
It was, long story short, I was in the hospital for COVID.
Okay.
And I was unconscious, not to my knowledge.
Were you on a ventilator? Yeah, you're on a ventilator, so they...
When they woke me up, I had a little temper issue. I tried to escape the place.
Yes.
To put it as nicely as possible.
That's okay, I understand.
So they had no choice but to put their
restraints
on me.
Okay. So there's a few things that could be going on. First of all, how long ago was this?
This when the trauma literally occurred.
When were you restrained? How long ago?
It was the beginning of December.
Okay. So we're into it about 3 months now.
Yeah.
Okay.
Around second week of December.
Okay. So the first thing is, I don't know how much of this is musculoskeletal, meaning the actual mechanical process, or how much is the nerve process, because with restraints, nerves can be tweaked, and the myelin sheath around the nerve can be crimped. And that sounds like what's going on with you, that it's starting to grow back. So for things like that, you want to be taking B6, 50 milligrams every day. Okay?
B6?
Yes. And then there's a test that we do in our office. It's a blood test that may be useful. It's called SpectraCell. You can't get it pretty much anywhere else except with certain doctors that do it. And it can tell us if you're low in vitamins, minerals, amino acids that could be affecting the nerve or the nerves that go to your ankle and to your foot. Okay?
All right. And what about the EKG, the neurology test?
That's an EEG, not an EKG. EKG is cardiology. Yeah. I don't know what happened with your...
Well, is that I'm still waiting. The earliest appointment I was able to schedule with a neurologist is coming up on March the 14th.
Okay.
But I was just going to ask you if that's...
yes, you need to get the... It
can't hurt to take one.
No, it can't hurt. Well, it does hurt, but yeah, because they're going to put needles in you and use electric shock. So yeah, I've done it to myself when I was teaching over at UCLA to show the residents how to do it. It does hurt. It's not terrible, but it's called an EMG, electromyogram, and an NCV, nerve conduction study. Okay, the velocity, nerve conduction velocity study. And that'll tell, make sure they do both ankles to compare. Make sure they do both legs to find out if it's coming from your back or from the knee or on the ankle. There's a lot of different nerves going there.
Well, I could tell you the restraint was it was low, very short.
We're going to a break now, Alex. So we'll catch you at the other end of the break. If anyone wants to speak to me live, like Alex is doing, give me a call right now at the studio, 866-870-5752, 866-870-5752. And then if you want to get me at the office, the number there is 800-300-9300. We're coming to the break.
You're listening to Living Pain Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.